Think about your own life. If you had people taking care of you, making all your decisions, what is there to life, really? And almost all the social programs we set up take care of us, or put us away in institutions to be cared for. And I think once I began to discover that, how important it is to help yourself.
We started actually as a project of the University of California, which was then called the Physically Disabled Students Program. And that was started by a number of people with disabilities who were students at University of California.
Ed Roberts and another student were in the hospital here at Berkeley, because for them to be Berkeley students, they had to live somewhere that had facilities where they could have help and where they could live with, everything was wheelchair accessible, and that was the hospital. So after a couple of years, they got tired of that, and they started this whole movement.
But as these people with disabilities made changes on campus, they had some success. They learned advocacy strategies and skills. But then when they began to graduate, they realized that they needed to be able to live in the community, and the community wasn't accessible. So they took the skills that they had learned in terms of advocating at University of California and started the Center for Independent Living in 1972.
This is the second independent living center in the country, right after Berkeley. We've been here since 1976 and served, countless numbers of people. In the beginning, it was really largely people with mobility disabilities. Now, 80% of our client base is mental health.
Well, independent living centers, while we have a variety of services, every independent living center has the core services of advocacy, information and referral, housing, peer counseling, independent living skills training.
When you first get injured, you don't know anything about the services that are available to you. If you have a child with a disability, there's a steep learning curve. And that's one of the things we do, is to let people know what their options are and give them some help with some of their choices.
It's a little scary going back to work after you've sustained a disability, or maybe if you've never worked and always had a disability. So we offer work readiness classes that talk about self-esteem, how to do a resume, how to talk to your employer about your disability.
During the time that I'm at work, I'm also helping people with disabilities. And, because of my experience in life, I can help them out.
I came here and found that there were art classes and writing groups and peer counseling, and I just hopped in and started doing stuff and started feeling better, and what I learned here I can pass on to others, and I do it all the time.
In a broader sense, an independent living center is a place that helps people navigate systems and gives them support for what they need to live a good quality of life in the community.
We provide ramps to houses to increase accessible housing stock.
I help people find attendants in their homes, people who cannot take care of themselves.
We have a youth services department that works with young people with disabilities. We have employment services and other kinds of services that help people fully be able to live in their community.
We're mapping out all the disability resources in the county of Los Angeles and the state. And, basically it allows members of the disability community to go online and share their personal knowledge about the disability features in their area. Wheelchair repair shops, drive-through Starbucks, accessible playgrounds, beach wheelchair locker programs, performing arts opportunities, mental health facilities, sober living facilities that are accessible.
An excellent resource to find the center in your area is the Christopher Reeve Paralysis Resource Center, and I urge you to contact them.
I think that we have made great strides, and I think that the more we are seen, the more we are able to be seen, the easier it is for people to think about us, accept us, understand why there need to be ramps everywhere.
Today there are over 400 independent living centers across the United States. that are all independent nonprofits, and there are 29 centers in California.
We've been effective in creating an environment where people can live independently in the community and don't have a need to come back here month to month to get those services. They are independent once their situation is set up.
Now, look at me. I am finding an apartment. I'm living in a dorm right now. I have several friends who are in wheelchairs, and we're all doing our thing.
Yeah, I've been living in this wonderful apartment for 2 years, close to campus, so I can walk. It's the location where there's restaurants, grocery stores, movie theaters, everything within walking distance. So basically, all I need is a credit card, and I can go anywhere I want, and people help me, and yeah, I'm basically independent from everybody.
I'm pretty independent. I'm married. I have a home that I bought with my husband, and I pretty much do everything myself.
That's what independent living centers do, is make sure that all those resources are known to the people that need them when they need them.
And I feel free to do what I want to do, which is really one of the major points of being independent, is feeling free to make your own choices, to live your own life, and I do.